So my name is Murray Ramanathan. I'm an endoscopic sinus surgeon at Johns Hopkins. And the first myth I'd like to dispel is sinus surgery doesn't work. So in fact, a lot of evidence has shown that sinus surgery does work and is very helpful in the correct patients. So the cornerstone to determining whether or not a patient needs surgery is patient selection. Has that patient been optimized medically? Have they failed treatments? And if so, they may be a candidate for surgery. Endoscopic sinus surgery is not a cure for chronic rhinosinusitis, but it's a way of effectively managing the condition. What we normally do is open up the sinuses and allow topical steroid therapy or medications to get inside the sinuses to help control the inflammation or infection. If we do select the correct patients in these cases, they oftentimes do have very successful outcomes. The second myth I'd like to dispel is that doctors scrape the inside of the sinus lining during sinus surgery. Years and years ago, this is what was done prior to surgical advances, advanced equipment, and our understanding of the way the nose and sinuses work. Today's understanding demonstrates that the lining of the nose and sinuses is critical for the way the sinuses work and function. For patients that need sinus surgery, we precisely remove bone and tissue to enlarge the opening of sinuses, and in certain cases, if there's nasal polyps, we remove those nasal polyps. We do not scrape the native lining and in fact preserve as much normal tissue as we can. The next myth I'd like to dispel is that sinus surgery and recovery from sinus surgery is very painful. So sinus surgery itself, even though it's outpatient, is done under general anesthesia, so patients are not aware or don't feel any pain during the surgery. After surgery, the most common things that patients complain of are a sore throat from the breathing tube, typically for a day or two, followed by a little bit of local discomfort. We no longer routinely pack the nose after surgery. That's primarily because of precise cutting instruments that are available that allow the removal of tissue and bone without removing a lot of tissue. Therefore, the only patients we really pack are those with bleeding disorders or rare conditions. There's not a whole lot of other pain associated with this afterwards. The next myth is that it can take months to heal after sinus surgery. It really depends on the patient and the condition for which we're operating on. Generally speaking, the initial healing phase is the first couple of weeks. We do cleanings in the office to ensure that patients do heal appropriately without scar tissue. And a lot of the healing really happens behind the scenes when patients go home and do irrigations and the crusts fall off on their own. The next myth I'd like to dispel is once you have sinus surgery, you'll need more surgery in the future. This really depends on the type of sinusitis patients have. If this is chronic rhinosinusitis with nasal polyposis, that's oftentimes a very difficult condition to treat, and patients do need more than one surgery. If it's simple scar tissue that's removed, oftentimes it takes care of the problem and you don't need further surgery. The other aspect of the question of whether one needs further surgery is the extent of the surgery they had. If there's still residual disease that's left behind, they probably will need future surgeries. With the advent of image guidance technology, we're actually able to clean out the base of the skull and take out diseased tissue much more safely and much more precisely than we were years ago. The last myth I'd like to dispel is there's no need to go to an academic medical center like Johns Hopkins for routine sinus surgery. The advantages of going to Johns Hopkins for routine endoscopic sinus surgery is it affords patients access to expert fellowship-trained surgeons that actually only do sinus surgery and skull-base surgery. The other advantages are it affords patients collaborative consultations with expert physicians in ophthalmology, allergy, neurosurgery, and rheumatology for really complicated conditions. If you've had surgery before and are still symptomatic and still have problems, it's reasonable to seek out an opinion from an expert surgeon at a place such as Johns Hopkins.